Hi guys, welcome to my channel, Vitality Vibes with Nurse Rosa. In this video guys, I will be talking about hypertension, high blood pressure as we call it in the Caribbean. So guys, we all know that high blood pressure is one of the leading cause of deaths in the Afro-Caribbean community. Yes, it is one of the leading cause of deaths in the Caribbean. Now, what is hypertension? Hypertension is when the force of the blood in your arteries is so high that it leads to life-threatening diseases such as a CVA, which is a stroke, heart disease, and kidney disease. What are some of the signs and symptoms of high blood pressure? A headache. If you find yourself having a headache, especially in the morning, then your blood pressure is probably high. Dizziness and double vision. You're not supposed to be dizzy and you're not supposed to have double vision unless there's something going on with your vision, like cataracts or glaucoma or something, related to your eyes. Nosebleed. Sometimes the pressure is so high in your head that it pops the little veins in your nose that leads to a nosebleed. So those are some of the common signs and symptoms of high blood pressure, hypertension. Now guys, if you're having any of those signs and symptoms, then the first thing you should do is go and have yourself checked out with your doctor. Guys, I'm going to go over a list of things that causes your blood pressure to be elevated. Sodium. Now, in the Afro-Caribbean community, because back in the days when we were enslaved, and we were given the little scraps of meat, such as the pigtail, the pig feet, and the cow skin and stuff like that, they had to make it tasty. So what they did, they put a lot of spices and a lot of salt to make it tasty. And so we grew up with that. So we tend to put a lot of sodium in our food. And the sodium builds up volume. Sodium builds up volume in our body and it builds up the pressure. So it elevates our blood pressure. Now, also our diet. Now, we, the Afro-Caribbean community, most times cannot afford to have the diet that is recommended for your blood pressure to be at the norm. They are recommending fruits and vegetables, whole grains and wheats, and we sometimes cannot afford it. So we tend to eat the food that we can afford, which is not on the healthier side. Stress. We also have a lot of stress. We have family dynamics, we have financial issues, we have housing issues, we have food issues, we have kids issues. We have so many things that put a lot of stress on the body and that elevates the blood pressure as well. Exercise. Sometimes we're too busy because they're too busy working 2 jobs, trying to put food on the table, trying to send the kids to school, trying to take care of your parents, trying to take care of your grandparents. You cannot find the time to exercise. And with these things, we tend to become a little bit overweight, puts a lot of pressure on the heart. The blood starts pumping with force, elevates the blood pressure. So guys, if you find that you're having the symptoms that I mentioned before, the first thing you should do is go and seek guidance from your physician. According to the American Heart Association, a normal blood pressure is 120/80. I'm not sure what it is in Jamaica, guys. Please let me know in the comment section. So you go and you speak to your physician and you tell him all the signs and symptoms that you're having. Of course, he's going to check your blood pressure. And if it's above the norm, most likely he is going to prescribe something for you. You should not take anything from your friend, your neighbor, your children that was prescribed for them, because each medication works differently for each patient. Most medication is given to you based on your height and weight and based on your symptoms. So do not take anybody's medication. Okay? When your doctor gives you the medication, I suggest, if you can afford to get yourself a blood pressure monitor. And before you take your blood pressure, especially if it's new to you, measure your blood pressure. And if it's too low, you call your physician and see what he says. No, most time when you get a new medication, it's new to your system, it will drop your blood pressure so fast. Now, if you're not measuring that blood pressure and your blood pressure dropped and you're not aware of it and you take the medication that was prescribed, it's gonna make it lower, and then you will be hypotensive, mean low blood pressure. Okay? So how do we prevent hypertension? We do a little bit of exercising, 30 minutes per day. 30 minutes per day of brisk walking, back and forth. You don't even have to go outside, in the house, back and forth, back and forth, back and forth. Eliminates sodium out of your diet. Guys, it might taste funny to you the first time, but trust me, you will get used to it. Eliminate sodium out of your diet. Drink a lot of water. Drink a lot of water. Rest. Get a good night sleep. That will reduce your blood pressure. Now, if you feel that you can control your blood pressure by yourself at home, there's a few herbs that is recommended. Hibiscus is one of them. We all love hibiscus. I'm not telling you guys to go and drink it, but it is recommended. Hibiscus is an antioxidant and a diuretic. So no, a diuretic is something that gets rid of the excess fluid that you have in your body. So with the hibiscus, it gets rid of the excess fluid that is building up the volume that causes your blood pressure to be elevated. They also say moringa is good. So moringa is good for the heart. That's what they said. So you know, with high blood pressure, affects the heart because it's pumping. It's because of the pressure in the arteries. The heart is working too hard. So they said the moringa relaxes the heart. They also said garlic is good. Garlic is anticoagulant, so he circulates the blood. So the blood is flowing freely. There's not that force that's building up to elevate your blood pressure. And foods that's high in potassium. Potassium counteracts the sodium and get rid of that volume that's building up to cause your pressure to be elevated. Guys, I will be giving away 5 blood pressure monitors. So if you would like one, please comment, enter. I am going to take the names of the people that comment and I am going to put them in a box. I'll be pulling 5 names and I will be shipping them out to you. I hope you like this video. Please let me know in the comment section if I missed anything, if there's something else that you would like to know, something that you want me to speak more on. It's my first video, so please don't be too hard on me. Thank you.